Okay? Okay, so this is, we're talking about one of the studies talking about angiogenesis. I talked about those vessels growing in, right? This is one talking about GHK. There's something here about NF-kappa beta anti-anxiety. That's actually something that has to do with cancer cells, and this will reduce that too. Just incredible.
Wow.
Okay, going back to this study. Now, so we know all the amazing things that copper peptide do, right? You understand that now? Now, the study, they actually looked at the concentration in the blood, and they looked from day 2 to day 7, and they had a statistically significant increase in the copper peptide. And that's what's really incredible about this. So what happens when we put it on our skin, right? Sort of the way that sunlight will take cholesterol and turn it into vitamin D, this photobiomodulation is the idea, and the copper peptide does this as well. These are some of the things we were talking about. It helps the skin, depth of wrinkles. It's been useful in metastatic colon cancer. We can't say that it's true that LifeWave does that, but copper peptide does do that. In addition, it helps people with chronic obstructive lung disease and increases superoxide dismutase, COD1, which is an antioxidant, anti-inflammatory. Okay, moving along here. So they did get a patent on this, and what we're trying to do is actually reset our genes right back to a younger state. So we can, it was first isolated in 1973, well, in part we hope it gets a Nobel Prize for that in the future. It converts older liver cells to a younger state. It actually helps with collagen repair and resets genes back to younger state. This is copper peptide. Once again, if there's somehow, maybe someone in the audience knows how we raise copper peptide. Is there a way? Because if we could, the effects are incredible. Okay. So we put it on the body and it reflects back our own infrared energy, and that causes an upregulation of copper peptide, and then copper peptide recruits cells to the area, and they go throughout the body. Wherever there's something known as a cytokine. It's sort of like a homing beacon. Wherever you have inflammation in the body, that's where the cells will go. Okay. This was a study I found that was really interesting too, is that they did this in Japan. They found if you're in a really dark room, we actually glow. We actually put out light. We're these souls in these bodies, right? Putting out energy, putting out light. And they've actually shown this before, so there's a lot to this photobiomodulation science. So the benefits we can see, it will actually raise this level of peptide to activate stem cells. Immediately people will actually have a calming, that's what I was saying, where they have antioxidants decreasing inflammation. Some people have said, well, my pain is reduced soon after putting this on. That's because of these effects. We can increase cellular energy this way, we can get better sleep this way, and then there's pain relief. I'm going to talk about this for a moment. So one of my first people that I knew had the effect was a colleague of mine. He's a surgeon. He was one of my mentors. His name is Dr. Alan Wolk. He's up in Philadelphia. So he's one of my initial mentors in this field. And we were talking on the phone, and we were talking about exosomes actually at the time, trying to heal people faster from my procedures. And he said, yeah, Adam, I'm having a problem with my wrist. I'm gonna have to have surgery next week. I said, Alan, hold on, let's wrap around the end of this conversation. I'm talking about the exosomes. Let's talk about that because I have this new technology that might help you. So I overnight the patches to him, and he gets it like on a Wednesday night, starts using it on Thursday. He didn't tell me, but his back was having an issue, real issue. He had steroid injections into his back on Monday. He woke up Thursday trying to look to see if he could have more steroids injected in his back because his back was hurting him. So he writes here, Adam, yeah, weird, yes, I've been having a lot of back pain. Pretty sure I was going to need a laminectomy. I had an epidural test. The patch went on around 7:15. The nurses never saw me jumping so much. They actually commented on it. My back feels about 75%. Don't understand. He says, I don't know what the F this is, but I have never taken this thing off. I said, Alan, no, you got to take it off. 12 hours, you want to re-stimulate the body, okay? You got to do that. So this is amazing. Now, actually, I've heard from him. He's actually canceled his appointment with his neurosurgeon because his back is doing so well.
Wow.
How incredible is that, huh? Okay, wrinkle reduction. It can actually help skin. Look at this. This woman, Maddie, was using this about a year or so. Look at her skin is better. Now, I do things help skin, but this is incredible that it has this effect too. Sports performance actually helps people repair their bodies after injuries from sports. Hair growth. This was really incredible. We've seen this too. And this was something that was sent, to someone about using the stem cells. Look at the amount of hair that he regrew after about 6 weeks of being on the X39. This was really incredible too. So wound report. This guy on the right, he was a rafter. He fell through the ceiling. He broke 6 ribs. Puncture was long. They expected like a 6-week recovery. He was back to work in 3 weeks. I'll tell you, my mom, myself, she had a problem where she fell She crushed her L5. She required probably about 6 weeks to heal from that. We put her on the patch. After about 3 weeks, she was doing better. It's incredible how this is working. And I'm about to show you some photos that are going to blow your mind on how this works. Okay, this is also after radiation treatment. Brain health, it helps as well. Scar removal, this was someone who had bypass surgery, and this is in July of 2018. 1 month later, look how the scar improved, because we know that it can build new collagen as well. Same thing here on the foot as well. And then wound healing, we're seeing a dramatic amount of wound healing. This is also a surgical scar after about 2 weeks of having it on. It's really, what I'm seeing here is the anti-inflammation is really helping here, because after 2 weeks, it's incredible that the inflammation went down that much. But that's what, if we can increase copper peptides somehow, I don't know exactly how, but if we could, that's what it can do. Okay, and then youth renewal. Okay, so once again, wrapping back, so my surgical practice. So I use laser technology, and I can drastically improve the appearance of aging into younger, healthier, more attractive skin. However, the healing takes about 10 to 14 days and a few months for full recovery. So I've been searching really for a while of ways to speed up healing for my patients so they get back to their lives a little bit. So the reason I did it, because I've been researching ways to speed up healing. And I've actually done studies. So this is this reset procedure that I do. I can take sun-damaged skin, I remove it, the body rebuilds itself, and then we get much healthier skin. And it looks a little bit unreal that can really happen, but if we can get the body to renew itself, which is what I do, we can get really incredible outcomes. We do it for men too. You can see that crepiness under the lids. Same thing, we injure the skin, and then the body heals it. But these results will often take 2 weeks, a couple months for full recovery. We do it for this gentleman too. You can see how those lesions in his forehead are gone, and he has all this healthy skin. He looks almost like his younger brother, I think. And then here too, you say, is there a cream that does this? No, but if I can take the skin down a couple layers and allow the body to re-heal itself, then we get brand new cells there. Same thing here, you can see she was actually sent to me because of basal cells that she had on her face. And when I'm doing this, I actually get rid of skin cancers at the same time, as well as making the skin look better. Okay, moving on. So I have done studies over the years looking at the different phases of healing: hemostasis, inflammatory, the proliferative, the remodeling phase. I've done studies using transitional cell-based membranes, O-beta-glucan, collagenases, amniotic stem cells. Interestingly, there was a group out of Santa Monica called Sky Orthobiologics. The CEO flew out to surgery with me, and we injected his amniotic stem cells from his company in his face, and he absolutely healed faster. So that was interesting, but that was somewhat expensive, I have to say. Hyperbaric oxygen also works. But the last thing that I'm using now for all my patients is X39. X39 is helping all my patients. Now, this is going to be amazing. I'm going to show you these pictures now, okay? So now, first of all, I want to say that LifeWave does not say that we treat any specific diseases. I can't say this would be for everybody. I'm just saying this in my experience, this is helping, okay? So there are 3 patients. Can you see them? This is all before surgery. The one it'll be on the left for you, I think, without the patch, and then those 2 people actually wore the patch about a month prior to the procedure, okay? And watch this, ready? Are you ready? Okay. Okay, look at the difference here. So look at without the patch. You see the redness? You see the yellow under the eyes? That is what I'm used to seeing. I've been doing this for 23 years. That's what I'm used to seeing in my patients. Look how amazing it looks for the people who've been on the patch for a month. Is that incredible? They look like patients who are about 10 days after surgery at day 6, okay? And I'm gonna go into next one. Here's 10 days. 10 days later, these patients on the right with the patch look like they're about, in my estimation, about a month after surgery. It's incredible. And look at the redness that she has, the person who doesn't have the patch. So this is 10 days. I'm gonna keep those photos together, so that's her at 5 weeks is almost equal to these people at 10 days. So this is real proof that this is absolute. So I have it's not exactly controlled, but we had people who've done this before. So in my experience, this is absolutely working. So all my patients are going on this now a month before, and then I'm hearing all the testimonials of how their hands are getting better, the back pain is getting better. So I am so excited about this. So I want to thank you so much for your attention. If you want, I have a QR code here. If you want to take your phone up and scan that QR code, I have a longer version of this lecture that you can actually hear at home. And my book is on Amazon. It's a bestseller. If you want to know about nonverbal communication, how we communicate with each other, you can get that on Amazon. And if you want to follow me or DM me with any questions on Instagram, you can do that. So you can take a picture of that if you like. And guys, I want to thank you so much for allowing me to speak to you. This has been an honor, and this is it.